Older adult health issues. When an elder dies, a library burns. African proverb. Aging is not a disease, but a normal part of the human condition. It cannot be prevented, and the process of aging requires many difficult transitions. For most people, it means retirement, a substantial drop in income, health problems, debt of friends and relatives, and other social adjustments. The older population, also called seniors or elders, is generally defined as those 65 years of age and older. There's an unprecedented growth in the 65 and older population. In 2016, they were estimated to be 15% of the population. By 2030, they will be 20% of the population. And by 2060, they will be 25% of the population. The baby boomers are driving the increase in the older adult population. Baby boomers are those adults who were born between 1946 and 1964. The older adult population can be divided into three age cohorts: the young old, 65 to 74, the middle old, 75 to 84, and the oldest old, those 85 years and older. And interestingly, those 85 and older are the fastest growing age segment of the American population. American older adults are a highly diverse group. They are diverse by race and ethnicity, income, education, culture, language, and citizenship and immigration status, as well as living arrangements. Older adults from vulnerable groups are more likely than other older adults to have language barriers, fewer years of education, substandard housing, high levels of poverty, poorer overall health, and lower life expectancy. Let's take a look at poverty. Poverty impacts older adults more than any other age group due to retirement, lack of regular income, little or no savings, the death of a spouse or partner, medical bills, and not eligible for Social Security benefits, especially if you've not worked and paid into the Social Security system. Poverty increases the risk for food insecurity, limits access to nutritious foods, limits access to quality, affordable health care, impacts ability to pay bills, and restricts transportation. Social Security benefits play a vital role in reducing poverty among the elderly. It is the main source of income for those 65 and older. Without Social Security, about 37.8% of the elderly Americans would have incomes below the official poverty line. Social Security is particularly important for elderly women and people of color who have fewer retirement resources outside of Social Security. The high rate of poverty and low education level among older adults contribute to economic disparities. Economic disparities begin during the working years, which leads to financial insecurity for the retirement years. Many minority elders depend on family and extended social networks to fill in the gaps. Now let's take a look at health issues and other concerns. The human lifespan is the maximum age observed in humans, which is usually defined as 120 years. On the other hand, life expectancy is the average number of years you can expect to live given your death, date of birth, and race ethnicity. The life expectancy for someone born in 2000 is 77 years. For white females, it is 80 years, white males, 74.9 years, black females, 75.2 years, and black males, 68.3 years. Notice that when we look at these groups, women outlive men by several years, regardless of the race. Several key factors increase the risk for developing diseases, injury, disability, and early death among the elderly. Many of these factors are affected by lifestyle, and a few are affected by the aging process. Chronic diseases lower the quality of life for older adults and contribute to the leading causes of death among this population. Alzheimer's disease and other dementias are most common in adults 60 and older, and the risk increases with age. Health care and long term costs associated with Alzheimer's and other dementias are some of the costliest conditions to society. Other health issues for this group: heart disease, stroke, hypertension, obesity, type 2 diabetes, cancer, Alzheimer's disease, and dementia. We're also concerned about physical activity, malnutrition, arthritis, chronic bronchitis or emphysema, dental caries and missing teeth, cirrhosis of the liver, osteoporosis, depression, and suicide. Falls are the leading cause of injury among older adults, and they're treated in emergency rooms every 13 seconds. And unfortunately, falls also claim a life every 20 minutes. Every year, 1 out of 3 older adults fall, yet less than half tell their doctor. Accidents or unintentional injuries are the seventh leading cause of death among elders. That includes motor vehicle accidents, pedestrian crossing, fires and burns, and choking. Disability is not synonymous with aging. However, arthritis is one of the leading causes of disability in older adults. And going along with that, we now know that reduced vision and or blindness can occur more frequently with the aging process. Many also have hearing impairment as they age. Emerging issues in healthcare for this population: person-centered care planning that includes caregivers, quality measures of care and monitoring of health conditions, fair pay and compensation standards for formal and informal caregivers, and minimal levels of geriatric training for health professionals. Now let's look at caregiving. Caregivers provide ongoing assistance with activities of daily living, and there is now an unprecedented need for paid and unpaid caregivers. Caregivers are at increased risk for negative health consequences themselves, including stress and depression, and they need increased support to preserve their own health. Issues are greater for caregivers of people with Alzheimer's and related dementia. There are several types of caregivers that include family, a professional through an agency, independent, non agency related, private duty, usually a medical professional, informal caregivers like friends, neighbors, and volunteer, such as those in respite or hospice. Many minority elders live in multi generational households, and they are often cared for by female relatives, daughter, and specifically the oldest daughter, wife of the oldest son, and female grandchildren. English is not the first language for many minority elders, which adds another level of care to family members. In summary, the number of older adults will continue to grow, and familiarity with demographic data is crucial to understanding elders and the multiple factors that affect their health status. Information concerning the living situation, financial status, healthcare utilization, morbidity, and geographical distribution of older people allow a realistic appraisal of their characteristics and needs.